Hello, everyone, and welcome to today's webinar, Seeing Beyond the Pandemic, Eye Health, Vision, and Learning. My name is Holly Kurtz, and I direct the Ed Week Research Center. Education Week is our webinar host, and I will be your moderator. Education Week is only hosting and moderating this webinar. Opinions are the sponsors and don't reflect endorsements by editorial projects in education or our publications. The sponsor, the American Optometric Association, is responsible for selecting the content and the guests. I am responsible for introducing the webinar, creating the questions you'll hear me pose to our panelists, and selecting questions for the guests to respond to during the Q&A, which I hope you will participate in. But before I tell you any more about the webinar and today's theme, let me highlight a few housekeeping issues. First, check the audio setting on your computer as well as your speaker volume settings if you're having audio trouble. If you're still having issues, please see the detailed audio troubleshooting file available in the resource list beneath the Q&A window. There are also some other icons at the bottom of the webinar console that open additional feature panels. You can read about today's speakers in the speaker bio panel and access the resource list to download a copy of today's slides. Finally, an on-demand archive of today's presentation will be available online in the next 24 hours. Both the archive and other resources will be available through edweek.org. Okay, let's get started now with our webinar topic, Seeing Beyond the Pandemic, Eye Health, Vision, and Learning. Teachers and parents alike are concerned about the social, emotional health, and academic impact of that the pandemic has had on children. We know that social distancing requirements, loss of income within families, and disruptions related to accessing health care all can impact children's overall well-being. This webinar is going to provide information about the links between vision and learning and how the pandemic and distance learning may have impacted children's eye health. Our panelists will share information regarding digital eye strain and other conditions brought on by the increased use of digital devices for online learning, and we'll also be talking about what parents and teachers can do to help. I'm going to kick off the panel discussion by first introducing our guests. I'll start with Michelle Andrews, OD, who joined CooperVision in 2015 and serves as Vice President, Professional and Government Affairs, Americas. She earned her Doctor of Optometry degree from the Illinois College of Optometry and completed her residency training at the Department of Veterans Affairs Medical Center in Huntington, West Virginia. Her clinical career spans many years in multi-unit ophthalmology practices, LASIK surgery centers, and private practice settings. Prior to CooperVision, Michelle assumed leadership roles within the optical industry for LensCrafters, iMed Vision Care, and 4Eyes Optical Company. In 2018, Michelle was honored with the Roger Kame Award by the AOA's Cornea and Contact Lens section and was named to Vision Monday's Most Influential Women in Optical. In 2019, she was recognized with the Thea Award for her work in industry. Our next guest is Teresa Lee, OD, and Teresa's Head of North America Professional Affairs for Johnson & Johnson Vision. She's a 2002 graduate of the State University of New York College of Optometry, and she brought over 12 years of hospital-based and private practice optometry experience to her Johnson & Johnson Vision position. Prior to joining Johnson & Johnson Vision, Dr. Lee opened a private practice in Irvine, California, spoke to doctors across the country as a professional affairs consultant, and served as program director at the Johnson & Johnson Institute. In a role now leading the professional group, Dr. Lee oversees Johnson & Johnson Vision Care's support of professional advocacy, education, and relations, and serves on the North American leadership team. She's a strong supporter of allyship and diversity, equity, and inclusion within and external to Johnson & Johnson Vision. Dr. Lee is also a member of the American Optometric Association and a fellow of the American Academy of Optometry. Next, we have Erin McCleary, OD, and she's a partner in Clear Horizon Eye Care in Connecticut. She grew up on a farm in North Dakota, and she graduated summa cum laude with honors from the University of North Dakota in 2003. She then moved to Oregon to attend Pacific University College of Optometry, and she received her doctorate of optometry with honors from that college in 2007. During her time in the College of Optometry, she obtained membership in Beta Sigma Kappa International Optometric Honor Society and was awarded the Toll Greenstein Award, which honors excellence in pediatric and binocular vision. She has been practicing advanced optometric care in Connecticut since 2007, and she's very active in the Connecticut Association of Optometrists. She received the CAO Young OD of the Year Award for 2010. And she served on the CAO Board of Directors since 2011 and is currently the association's vice president. Next, we have Ryan Parker, OD, who's Director of Professional Development for Essilor. He grew up in Buhler, Kansas, and received his undergraduate degree from Oklahoma State University in 2000. He graduated from Oklahoma College of Optometry at Northeastern State University in Oklahoma in 2004. He opened Ardmore Premier Eye Care in 2007 and is proud to be among a select group of optometrists in the state of Oklahoma that have completed the training to become licensed to perform PRK surgery. In 2018, he joined Essilor full-time as the Director of Professional Development. Dr. Parker has been featured in articles and television interviews talking about various programs and technologies that Essilor uses to achieve its mission of improving lives by improving sight. He's lectured on practice management, spectacle lens technology, and myopia management to numerous eye care professionals. He's a member of the Texas Optometric Association and the American Optometric Association. He's also a licensed private pilot and enjoys flying in his spare time. So quite an impressive group we have here. So we're going to start off by having me ask some questions of our esteemed guests. And then towards the end of the webinar, we are going to open it up to your questions. So please, as you listen to our guests talk, submit questions to the Q&A box. And if you don't do it while they're speaking, go ahead and submit them once we start the Q&A session. So our opening question today is a little bit of a warm up because today our audience, obviously you all mostly are not optometrists. Most of you, I would think, are probably educators. And so I'm wondering if our panelists can start by sharing some background information on the connection between children's eye health and learning.
I'll start that one, Holly. It's Carissa. A couple of things to keep in mind is, especially if you're not familiar with eye care, is that eye health is an important component of overall health. So sometimes we do forget that our eyes are connected to the rest of the body. And there is a strong connection between visual health and learning. So when we think about behavioral or compensating issues, especially in school-age children, problems with vision and things like visual perception can often be attributed to some of these issues. And a lot of us only think about eyes in terms of refractive error, what prescription we've got. But visual function issues like eye teaming or how the eyes work together are also really, really important when it comes to how hard kids have to work to learn. And, I also want to point out that vision screenings, which are probably happening at your schools already, they're important, but that all children really need that full comprehensive eye exam where an eye doctor checks not only if they need a prescription, but also they would check the health of their eyes and how those eyes work or team together. So when we rely only on the screenings, it may easily uncover things like myopia, which is also known as nearsightedness, but a refractive error, which we call hyperopia or farsightedness, can often be missed, which can lead to avoidance of near work like reading, or even manifest as behavioral issues because it's so difficult for these kids to focus. So, when I saw patients back in practice, I would always look at them holistically, thinking about things like nutrition, inflammation, outside stressors, things like that. And we have to understand that preventative eye care or early detection is really critical. especially when we consider this looming epidemic that we see and the implications of myopia progression in children, where that prevalence has nearly doubled within the last 20 years.
Okay. Thank you for that overview of the connections between children's eye care and learning. Let's talk now about, I'm wondering if you could talk a little bit about the role that optometrists play in helping to maintain children's eye health.
I can take this one, Holly, since as you can see, I'm actually actively in clinic right now today, in between patients. So this is what I'm doing day in, day out, in the trenches. And, you know, as an optometrist, we're very fortunate that we get to play a role as general primary caregivers to, you know, families and children. As in, you know, we are literally the ones who are examining and treating children with their eye health conditions. But, you know, we actually serve a role in, you know, a far greater connection with whole body and with the rest of the providers. And I would say that as optometrists, we get to serve as a conduit. Not only are we a conduit from children who having failed vision screenings at school or screenings at the pediatrician's office, but we then become also a conduit to specialty care or additional testing that needs to be obtained after we find maybe atypical findings in our examination. And I mean, ultimately, as optometrists, we're kind of the gatekeeper. You know, we're able to help connect the ends of a very multifaceted, you know, system and provide those care for these kids. I mean, we see it, there's different examples, or we have so many examples, but to kind of break it down to two, we have the visual example. So we're talking about eyes and vision and learning today, right? So that's the whole point of this whole webinar. And this is classic. I see it all the time. A kid comes in for a routine eye exam and, you know, they're seeing 20/20 in their vision. And, but then I check their focusing system. I check, like, you know, Carissa, Dr. Lee mentioned with their eye teaming, and something seemed off a little bit. And so I asked the parent, I'm able to ask further questions like, you know, how's the kid doing in school? You know, how's their reading? How's their fluency? And lo and behold, this child, they're receiving services at school for reading. Well, now we know why. And so then I can be then that gatekeeper to say, well, you know what, this child really would benefit from vision therapy. And I can help refer them out, get information to like occupational therapists, and then can come back to the specialty care at school. And I'm really making sure everyone's connected and on the same page. You know, alternatively, I mean, that's really vision, but we also have medical pieces that we are connecting to, right? So we have a kid who comes in, great vision, and I dilate their eyes, and you look inside and we see swollen optic nerves. Completely asymptomatic, but that's a systemic problem. I'm able to connect them to neuro-ophthalmology, get more testing, systemic testing, and then am able to go back to the primary care doctor and connect those pieces. But I think definitely as optometrists, our role is to also provide education for families, not just reactive. We don't wait till we have a problem to educate families. This is an opportunity to say, hey, just so you know, these are some examples of when vision may be a stumbling block for learning in school, or these are recommendations for better, you know, visual health practices at home or at school, or hey, we found a problem with your child and this can be genetically predisposition for other family members. Maybe they should come in and get their eye exam as well. So we really want to help foster, you know, developing lifelong vision and eye health care for all these kids.
You mentioned something called vision therapy. Can you talk a little bit about what that entails for children?
So vision therapy is just one of those specialized facets of optometry. Optometry has so many different ways of practicing, kind of like medical doctors also have like surgeons for this and that. And vision therapy specifically is a more behavioral vision therapy attachment for treatment. So basically, if the focusing system isn't working right, or their eye muscles aren't coordinating right, or like Dr. Lee mentioned with visual perceptual problems that may be interfering, they work with special skills, almost like physical therapy for, you know, recovering muscles. They can work on the visual skills that these kids are needing to help make them function better in school.
Okay, thank you. I want to turn now to the role that educators do or should play in children's eye health. What might that be?
You know, we know that educators and schools play a very influential role in children's eye health. You know, there was a Harris poll completed in 2019, and it revealed that 7 in 10 parents shared that teachers and school nurses are the most likely to notice that children have vision problems. And 9 in 10 eye care professionals reported in that same survey that parents bring their children in for an eye exam often because they were prompted by that in-school screening. So it's critical. And in fact, during the time that children were home learning over the past year, it really gave parents some valuable insight into how their children use their eyes during the day to learn. This really helped increase the discussion around eye health, vision and learning, and device use. Many of these observations were formerly only known to teachers, and now they were being seen by parents and other adults in the home. And so teachers, school nurses, those in the school system are really key in identifying vision issues. And it's important for us within the vision care community to ensure that teachers have the information about children's vision issues. We've talked about vision therapy. We've talked about a little bit about myopia and what the implication of the entire visual health system, what that means to a child's development. And I think it's also important to realize the timeliness that we want to get children in for an eye exam so that we can address these issues and really get the best outcomes possible. So I think events like this and calls like this really showcase the opportunity for synergy between the eye care industry and the education industry to support school-age children. But I also don't want to gloss over the fact that optometrists in clinical practice, like Dr. McCleary, are already having these conversations, have already developed these relationships within their own communities. And so those relationships are critical, not only at industry level, but also at the local level to make sure that teachers, nurses, and others in the school system have the information and the support that they need to do the work that they do.
Okay.
I can even add a little bit to what Dr. Andrews was saying with the educators piece is that, like, exactly, they're sometimes the first line. They're the ones who see the kid, like, covering an eye, squinting, head turns, or like what Dr. Lee mentioned, where the child's living out, right? Like kids who have undiagnosed, hyperopia or farsightedness, they can't focus nothing worth beans up close. And so they live out. And so sometimes we see the kids who are moving around all the time. They're so key in helping to identify those to then subsequently get those recommendations out to get the vision care that they need.
Okay, thanks. And I encourage others of you to chime in too if you have other comments based on your colleagues' comments. Let's turn now to let's talk about the pandemic a little bit. How have you seen the pandemic impact the role of educators in schools and children's eye health?
Well, I'd love to take a stab at that one. Most of my family is actually in education. So this was a great opportunity for me to touch base with them during the pandemic. And let me just say, educators that are on this webinar today, I don't know how you did it. I mean, calling an audible, is your school open? Is it closed? I don't know. Oh, yeah, it's going to be open. Let's put 9 weeks of curriculum that used to be in person, and now we're going to do it virtual. So, wow, I don't know how you did it and stayed sane. But here's the thing. What we learned from this, education was impacted, and educators had a very, very tough job. Not all children learn like this. Engagement is tough virtual. I know many of us that are on this panel today do a lot of presentations, and I think I'm going to speak for all of them. We'd say we'd rather be live. There's something about being live to adult learning and children learning that is so key. Virtual learning is tough. There's lots of distractions. I think you also probably saw those educators. Parents also saw what a tough job you have as well. They're ready to get their kids back into the classroom because their kids drive them crazy at home and you have to put up with them all day. But here's the thing. You did an amazing job. Kids still learn. But what we're finding out now with some of the studies that are coming back is the fact that it wasn't the same. It's not the same learning in a virtual setting. Yes, many school districts, many people out there did an amazing job in doing the best we can. Like I said, not all kids learn like that. Not all kids had the access they need to the technology that gave them the best chance to learn. So I think what we're going to see as we come back, we're going to see, I know some studies have been out, that there may be like a 70%-ish retention rate in reading from previous years, and maybe as low as 50% when it comes to mathematics. So I think we did the best that we possibly could, but it showed the importance that teachers and educators bring to live and in-person learning. I think as we move forward, we learn some things. There are some things that can be done virtual, but it's really about getting back as safe as we possibly can and learning in the way that benefits most children.
Dr. Parker, I'd love to add to that. I agree with everything you've said. Some children also may be returning to the classroom this fall with vision issues that had gone unnoticed and may have exacerbated during the time that they were studying from home. And so, Dr. McCleary already talked about the kinds of things to look for, but as educators will need to raise those concerns that you have about potential issues with children's vision, and be aware of someone covering an eye or looking to avoid, or maybe a head turn or a head tilt. We would rather see these children and get them in for comprehensive eye exam and identify those issues rather than letting them go. So I think there's a lot to pay attention to as kids come back to school this fall. Mm-hmm. And I would add vision to that list as well.
Mm-hmm. Yeah. Let's talk about the elephant in the room here, which is the increase in the amount of screen time. I saw one study by a company that tracks device use by children between 4 and 15 that said that children's screen time doubled worldwide between May 2020 versus the same month the previous year. Even if it hasn't increased by that much, we all know, even anecdotally, that there has been a lot more screen use. How has the increase in children's screen time, how do you think that might have impacted children's eye health?
Well, Holly, we see strong evidence in the literature, even though this is recent evidence, but suggesting that the level of children's myopia has increased through the pandemic. So it's related to digital devices in that when children are on the screens, they're generally not outside. So the findings seem to be related to a decrease in the amount of outside time and the time children are spending outdoors at recess, when they would normally be live and in school. So the accepted recommendation for outside playtime is about 2 hours a day. So first of all, just making sure parents are aware of that. And as kids get back live into school, that, the outdoor time, not only for play, but also to have their eyes focused far away and to be outside is really important. And when we think about screen time, I know educators, as well as, us who are working on computers or working from home, as you all see our backgrounds, screen time has increased for adults as well. So, so when we think about kids and even adults, digital eye strain is a real thing. And sometimes kids are not going to complain about it. So I think it is great to proactively probe these kids, especially when they're back in the classrooms, about some of the things that we may see as symptoms, like headaches or eyes feeling tired. As mentioned before, the teachers who are on this call, sometimes you guys are at the front line and maybe the first to notice some of these problems in the kids. So it's always great to be proactive. So a good reminder is what we call the 20-20-20-20 rule. So I added another 20, but it's every 20 minutes when you're on this digital device, remember to look 20 feet away. So you're just giving your eyes a rest and relaxing those focusing muscles for 20 seconds. And then to keep that front surface of your eye nice and healthy, and to prevent dry eyes, is to blink completely 20 times. So a lot of 20s to think about, but I think it's a great thing to put into practice with kids as well as adults.
And I'm wondering if you could explain one thing to our audience, because I actually had to look this up when I first saw you all talking about it. What's the connection between spending time outside and eye health?
Well, there's a few different theories about it, but what we've seen, especially when it comes to myopia and the studies that have shown, is that spending time outside, looking far away, getting in a different environment, and making sure you're relaxing those focusing muscles. We also know that vitamin D is hugely important to our overall health as well. So getting that natural vitamin D outside to your skin is also just an overall holistic health component too.
Okay. So it's the connection in addition to the vitamin D, it's the fact that people kind of look more out into the distance when they're outside. That's what we think. Okay.
Yeah, and in small amounts, I mean, UV light is good too. I mean, not just for the vitamin D production, but there's some research that looks at the UV exposure as well in small amounts.
Everything is in relative amounts, right, Dr. McCleary? It's all great if it's balanced. Right. Yeah.
And I think that's one thing too that the pandemic showed us is outside is so important for everything that Dr. Lee and Dr. McCleary just talked about. But even beyond that, there's for visual development, there's certain wavelengths of light that we think actually you may be exposed to outside that can break the feedback loop on myopia progression. Early research there, but we know light's beneficial. And sometimes school is the only time kids got a chance to do that. It's the only time they had a chance to actually have forced breaks from their phones and go outside. So we really need to work together to get our kids back outside. I love the extra 20 rule, Dr. Lee. I couldn't wait to see where you're going with that one, but 20 blinks. I'm going to think about you every time that comes up. But outside is so important. Beyond just the eyes. Childhood obesity, early onset diabetes in kids. My gosh, did we have that 10 or 15 years ago? Absolutely not. But now that's a thing. And it's all about getting outside, getting exposed, getting physically active. And then it's all about balance, in my opinion. We have to do work up close. We get it. But think about how do we balance that? How do we balance our screen time with our outdoor time?
So that's actually a good segue into my next question, which is when it comes to eye health and children's screen time, how much is too much? So how much screen time should parents or teachers permit children to have, and how, if at all, might that vary for children of different ages?
Yeah, this is usually the question, Holly, that comes next when we're talking about outdoor time and the increased device use. And so I'll echo what my colleagues have said. Encouraging children to get outdoors for all of the reasons that have been suggested does also help get children off devices. And so it's a great place to start, and it has so many other health benefits overall. But the American Academy of Pediatrics recommends, in terms of screen time, that children younger than 18 to 24 months should avoid screen time altogether. They'll make exceptions for FaceTiming, for example, with family members, but outside of that, they really shouldn't be on devices. As children get to ages 2 to 5, they're recommending no more than 1 hour a day and with parental support. And then when we start looking at children over the age of 6, we know that these children are in school, and so there are different levels of exposure for school, but then there's also time on devices related to homework. And then, of course, children want to do things on devices for fun. And so once they get to age 6 and over, what's recommended is that families create consistent patterns around device-free times and perhaps even device-free locations. So, for example, dinner time, family time, right before bed, if families can start there and make those device-free zones, not having devices at dinner, not having devices during family time and right before bed helps not only with vision, but also with this focus on the overall child development, healthy nutrition, exercise, and of course, good sleep by not taking devices into the bedroom. So important ways to focus on children and device time, not just for vision, but for overall health.
I might even second on the sleep is a big issue, right? And I think one of the things that I hear every day all the time from parents is, what about this blue light business, right? And I think we're hearing that everywhere. I know Dr. Parker can speak to this specifically as well, but that actually has a big component tied in with sleep specifically, where we worry about this we hear about this blue light. Is it hurting my eye structure? And the jury's still pretty much out on that. Like really the amount that you get from a digital device, you get more blue light when you're outside, but you're constantly exposed to it when you're in front of the device. And what some parents don't understand is that the blue light actually can activate your circadian rhythm. So it tricks your body into thinking that it's still daytime. And so it makes it hard for these children to fall asleep at nighttime and not only get good quality sleep, just stay asleep. Like I tell my patients all the time and these parents that sleep is so important because as young developing bodies, that's when all of our hormones are developing and our growth hormones are regulating each other. And if we don't get good sleep, the brain isn't developing as well as we need to. And those are all things that need to be in place for good learning in school. So absolutely, like Dr. Andrews said, shutting off those devices at least an hour or two before bedtime is so important for all of us, not just little people.
Okay, I'll try to keep that in mind. Given the reality that remote learning during the pandemic did lead to an increase in children's screen time, what, if anything, can educators and schools do going forward to address the impact of this increase? So and I would say also what the families do.
Absolutely. I think Dr. Parker already kind of addressed this a little bit earlier too. And talking about all the impact that we've had from, negative impact from school. Dr. Lee mentioned the myopia increase, the asthenopia or eye fatigue and dry eye symptoms and things like that. But, what Dr. Parker said earlier was specifically we had this pandemic happen and we raced to fix. We had this big gap. All of a sudden, we knew that we had remote learning technology available, but we rushed to fill that remote learning gap without really fully taking into account what kind of visual or ocular eye health impact we would have from it. So I think going forward, having better synergy, like Dr. Andrews said earlier, better synergy between school administrators and educators and eye care professionals, like optometry specifically, where we deal with vision as a system, a binocular system, not just an organ. It's not just an eyeball that gets 20/20 vision, but having us work collaboratively going forward to kind of assess what kind of digital remote, devices are we going to be using in the school system for your curricula, and how is that going to be impactful on that visual system as well. And I think we've already kind of talked about these things where we can already do, what can we benefit from in the classroom setting. Educators, things like the 20-20-20 rule. I'll even add a couple twos to there. I'll say 2 minutes instead of 20 seconds. Get those eyeballs out of those devices and add those 2 hours of exercise, right? So all the twos, all the 20s. I think those are all great. And actually, one thing I think we don't talk about a lot is the ergonomics, right? So I think we spend so little time realizing that we have these little 6-year-olds hunched over their computers and these iPads that they're looking at, and we're already developing neck and spinal, abnormalities in these small people, the iPhone neck, right? And so we don't spend enough time talking about that with these children and families. So you're looking at screens, you want to have it an arm length away from your face, right? We want to make sure that it's 15 degrees below your horizontal meridian in a perfect environment so that we're minimizing dry eye and helping make sure that your neck and shoulder posture is comfortable. Making sure that we're educating all of these teachers to these points, and then secondarily passing that information again back to guardians. Outdoor time, Dr. Lee talked about that specifically too. And really, if we can be very synergistic and reinforce everything that I tell my patients every day and have educators understand that and try and make them, get it from both sides, I think we're going to have better outcomes than where we're at right now.
Thank you. I'm going to ask a follow-up question, which is that is in terms of students increasing the amount of screen time during the pandemic, are the effects permanent or can they be reversed?
That's a good question. Some of them can be permanent. Like, for example, myopia. If we have increase in myopia or nearsightedness, that usually doesn't go away. And it's multifaceted. It's not just this digital screen time, right? It's not just being indoors. There's genetics combined, but you have a whole subset of reasons why we have it. But once you become a -2 myope, you're not going to go back. That's permanent and progressive oftentimes unless we have interventions. Also, things like dry eye, we're seeing an increase, like a huge amount of people who are developing dry eye at very young ages now, simply because of the biomechanics of their eyes. They're not blinking enough. You're staring at a screen. You're not having digital things that you're moving and book turning pages. And so children aren't blinking enough. The glands, the actual oil glands in their eyelids are atrophying. They're not functioning because they're not getting used appropriately. And that can be permanent as well. So, I mean, it just goes back to, it's so important to be talking about these things early and getting that early intervention so that we can protect their eyes and vision and set them up for, better learning and ocular health down the road.
I'll add just one component about the blinking that Dr. McCleary was talking about. What we've seen is when we're on digital devices, we see a lot of what we call incomplete blinks, where you kind of start the blink, but you don't blink all the way. And what we see is that you need a complete blink to activate those glands that help prevent dry eye or that atrophy, as Dr. McCleary was talking about. So making sure that people blink completely, which sometimes you have, if you think about it, you can do it. But if you catch yourself, or if we actually video people, they have a lot of incomplete blinks when they're on these digital devices. So there's a lot of components that we don't think about that are important in overall eye health.
Okay, thank you. Younger children may end up wearing masks at school longer than adults since vaccines are not yet approved for their age group. And, older students may wear them too, because I know a lot of schools are hesitating to, require people to be vaccinated, for instance, to come back to school. So given that mask wearing for various reasons may continue longer in schools than it might be continuing elsewhere, how does mask wearing impact eye health, if at all? And if it does affect it, what can be done about it?
Well, I lost count, Holly, of the number of emails I received from customers and other people about what do I do about my lenses fogging up because of masks. Masks are where it was a warrior in the fight to slow down the spread of COVID. And we got to think about why. You put the mask on, breath does not exhale directly straight from your mouth out towards someone, but that air still has to go somewhere. It doesn't just disappear. We're still breathing. So it's got to go out, down, or typically up. And most masks are fit a little loosely at the top, so air is going to rise, and when you exhale, the air goes up. So let's do the spectacle lens stuff first. Yes, it's going to cause your glasses to fog up, and there's not a lot of great solutions. There are some things that are out there. We won't get into those right now because the question was more about eye health. It can negatively impact the eye health, and we go back to dry eye. I don't know what anyone else on this call right now. I'm thinking about not only how many times I blink, but now the quality of my blink. So I got to focus on the answer to this question. But blinking is important because masks can cause dry eye. Believe it or not, there's actually yet another acronym in the medical profession now called MADE, M-A-D-E, mask-associated dry eye, because that air going up can affect the tear film, can cause things like itching, burning, stinging. Be aware of that. Educators, look how the mask is fitting. That's the big thing. The mask really needs to be fit tightly at the top. Even, if they're going to wear it for prolonged periods of time, even a little bit of tape to make sure the top is down. That way the air is going down and out. The other thing students may have to do, sometimes you just can't get a mask to fit. I know I've got 17 million masks like probably everyone else does. Some fit, some don't. Good artificial tears throughout the day, is something that kids can do if their eyes feel itchy, stinging, burning. And here's the weird thing. I know this doesn't sound right, but when eyes get dry, they start to water. I know that sounds counterintuitive, but if you have that's the body's natural reflex to try to solve the problem. Dry eye itself, it can be minor, but here's the thing, folks. If it goes unchecked, it can actually cause some pretty decent and long-lasting vision loss. In addition to that, we're seeing higher incidence, and Dr. McCleary, I know, can talk to this better than I can, but you get those kids that have the red bumps around their eyes. We call them styes, chalazion, a million different words there. But an increase in those as well. Once again, it goes back to the health of the front part of the eye, making sure the mask fit properly, and then as best we can, using some different dry eye therapies to kind of help augment that until masks are no longer a thing that we have to deal with.
I was waiting for someone to talk about styes.
I could tee you up as best I could.
Thank you. Yeah, I cannot tell you the number of children I've seen with the increase of styes, not just children, but adults too, just because you're breathing up bacteria. And what do kids do? We touch our eyes all day long, and no matter what you tell them. Yeah, so it's been crazy rates of styes and chalazion all this last year.
And that's because of mask wearing, you were seeing that?
Yeah, you breathe up. So the process is that you're breathing, right? You have bacteria in your mouth. It comes up. Kids touch, their eyes are dry, like Dr. Parker mentioned. Kids are in the dirt. They're touching stuff. They got bacteria. Their eyes are dry. They rub their eye. You get bacteria up into one of those little oil glands, creates an infection. And that creates the sore red bump on the eyelid. So they're hand in hand and definitely made worse by wearing masks.
And then I just wanted to return to the question about some of the things. I think it was you, Dr. Parker, who said that there are some things that can be done about the glasses fogging up with mask wearing. Any brief hints of things that could help out with that for children who do wear glasses or educators?
Yeah, I know the most important thing, the simplest thing, is making sure that the mask, the glasses fit on top of the mask. So the mask fits tightly underneath. The glasses go on top. So a lot of times what happens is the glasses get behind the mask and you got no chance. You got no chance there because all that air that's going up is right on the spectacle lens. Making sure the mask is underneath it. Once again, a little tape at the top can make a big difference. I know when I have masks on, the ones that have the metal fitting right around the nose and really clamping that thing down can make a huge difference in the fogging up of my lenses. There are also some coatings that are anti-fog that can work. There are drawbacks to some of those things. You have to apply them. Sometimes they wear off over time. The simplest solution, in my opinion, is make sure you have the mask fit properly and a little tape at the top and tight fitting. Just like Dr. McCleary said, we're trying to keep that air from going up, not only to protect the health of the eyes, but also to keep the lenses from fogging up as well.
Okay. Well, that's very helpful, very useful to know. I want to turn now to something that's not necessarily related to the pandemic, although it almost certainly was affected by the pandemic. And I want to ask, what kind of eye exams or screening should children receive, and how often? When should they receive them? And also, just tell us a little bit about what those screenings do, what they check for.
I think you already got some great answers from Dr. Lee and Dr. Andrews on this a little bit earlier, but I can dive in a little bit. I will speak. I come from a role where I am what's called an infancy provider. This is a public health initiative that was started by the American Optometric Association from the AOA, where it's comprised of providers who volunteer their time to see children for full comprehensive eye and vision health assessments at no charge, free of charge, for children between 6 and 12 months of age. And so because I am this type of a provider, I'm a huge proponent of getting in early and getting seen often. And it's a great opportunity for us to start these positive balls rolling down the hill. And I think so often pediatricians are recommending getting, your first dentist appointment before some children even have teeth, but then forget that, oh, wait, we should maybe see an eye care provider as well. And as we've been learning today, that vision is so inherently imperative as a key component for learning that obviously this is something we want to set children up for life. Now, that being said, the AOA does recommend getting a full comprehensive in-person eye exams for children before school, ideally preschool or kindergarten, to make sure that we are, catching things early that may be negatively impacting their learning capabilities. But in lieu of that, there are vision screenings. And like Dr. Lee said, vision screenings are necessary for those who maybe aren't necessarily able to get a full comprehensive initially. They are going to be beneficial. They historically screen for myopia, which is that nearsightedness, or something called amblyopia. Amblyopia is where we have a reduced best corrected visual acuity. Functional vision is reduced even with glasses in place. And those are really the main components that vision screenings are looking for. Occasionally they can, on an eye screening can catch an eye turn if it's large or visible to the screener. And they do have some screening tools available now, some devices that can be helpful in catching some moderate amounts of hyperopia or farsightedness or astigmatism. But very rarely do vision screenings ever catch the things that Dr. Lee mentioned earlier, the focusing ability or eye teaming, and how the visual system works as a system. They're basically looking at vision one eye at a time, not necessarily how they work together. They're good, but they're not the be-all, end-all. And I would also just go to say further that there are some children that vision screenings really should be completely bypassed altogether. And there's a subset of kids who really should go straight to comprehensive eye exams. Those children are going to be preterm infant, so premature birth before 37 weeks. If a child has a neurosensory developmental disorder or delay, if we have a systemic condition that has ocular implications or potential connections. Also going to be if we have any visible abnormalities. So if we do have an eye turn, they need to get a full comprehensive eye exam. If they have an atypical eyelid formation or a droopy eyelid, something we call ptosis, they should be evaluated as well. And anytime we have a family relative who has amblyopia, which I mentioned was reduced vision, or strabismus, where we have the eye turn, misaligned eyes, they need to have full comprehensive eye exams. And really, anytime a parent has a concern, if they're just worried, you're going to find the most comprehensive evaluation feedback from a comprehensive eye exam.
One thing go ahead, Dr. Parker.
Okay. Sorry about that, Dr. Lee. Didn't mean to jump in there. This is kind of my virtual soapbox here. Screenings are a necessary thing, but there is nothing that replaces the skill and what you will get out of a comprehensive early eye exam. Remember, early and often. I don't want to use hey, I passed the screening as I don't need to get my eyes checked. I know every doctor on this call can tell multiple stories of kids that came in with a screening and they passed, and then we found something that negatively impacted their learning or could have negatively impacted their health. We've talked a lot about myopia. Here's the thing about myopia. The thing that I used to hear parents say all the time is, oh, little Johnny can see just fine. Why do I need to take him in? Well, here's the thing. You can have a 6-year-old kid that has no prescription and can see better than 20/20, but their prescription may not be where it should be. Us as doctors of optometry know that, and we could look at you as a mom and dad and say, listen, little Johnny's great right now, but if I'm a betting person, this kid's going to develop myopia because of where their prescription is now, and I know their age, and I know that mom and dad are both myopic as well. We don't need to take 2 or 3 years to see little Johnny again. We may need to see little Johnny again in 6 months or a year. And we just go back to the fact, Dr. McCleary, you hit the nail on the head here. This drives me crazy when parents are like, oh, I've taken my kid to the dentist 8 times. But I haven't seen the optometrist. My pushback there is you can eat without teeth. You can't learn and function without a healthy set of eyes.
Preach.
Although I think that we would agree that both of those functions the eyes and the teeth are pretty important.
Hugely important.
You know what else I think? Another thing to keep in mind too that the comprehensive eye exam reveals is also the frequency with which the next eye exam should happen. So Dr. Parker, really alluded to that. There's a general progression of growth of the eye as the child grows up, and if they're ahead of that, if their eye is getting longer faster, then we might want to see that child more often. And there's also a genetic component to some eye conditions. And so not only do we want to be having a conversation about the child that we're seeing in the chair, but we'll want to have a conversation with the parents about other siblings and the right frequency of eye care for siblings. Because again, anything we can catch early and identify early has the best opportunity for a good outcome.
Yeah, I will underscore all of that as well, because, as we think about the brain developing, especially in these school age kids and the connections that form with learning and that get reinforced, those same connections happen as we, from birth. And as Dr. McCleary was saying, she's an infancy provider. Those connections form between the eye and the brain as well as these kids grow up. So we want to make sure if they do have any problems like amblyopia, that we catch them early and that we can intervene so that they don't have lifelong implications on their vision and their eyesight. So, some of these things that we think about in kids that I saw in practice that had were diagnosed with ADHD, for example, they're on medications, it turns out that a simple vision therapy set of sessions or functional vision assessment can help them with some of the manifestations that may get misinterpreted as ADHD or some other behavioral issues. So just ticking off the box to say, okay, I've got to see my pediatrician, parents saying, okay, I got to take them here and here. Let's take them to an optometrist and eye doctor. Let's check the box off to make sure their eyes are working well and functioning well. It should just be part of that whole package.
And Dr. Lee, I don't know if you saw this as well, but I know I saw it. Sometimes parents don't understand the amount of data that we can get from an infant, from a 6-month-old, from a 12-month-old. And I'm speaking for Dr. McCleary here, but I guarantee she would rather in clinic deal with that problem at 6 months of age than at 14 years of age. And a lot of times parents don't think, well, they're too rambunctious, they're 2, they're 3. I don't want to bring them in until they're 6. You can reverse a problem the younger they are. And then if you wait too long, you have to deal with the problem. And we don't want to deal with problems when they can be reversed early on. It's all about early and often eye exams.
Yeah, if I could tell you how many times I've seen a child, I'm like, I wish I saw you 4 years ago.
Mm-hmm.
Yeah, that's good to
We
remember.
don't have to know their letters to bring them in, so it's okay.
Yeah.
No, there's so many techniques. You can get visual acuity on an infant. They can be 4 months old, 6 months old. I can tell you if their visual system is processing right.
Wow. So I'm going to turn now to take some questions from our audience. We already have some questions, and if you're in our audience, I'd encourage you to submit some more that may have arisen in response to this very interesting and lively Q&A. This one question that we have, though, kind of segues into a question that I was going to ask you, and this question from Teresa relates to services available. She's asking specifically for like lower income preschoolers, but in general. What can schools or educators do to assist families with eye care if they cannot afford sufficient eye care on their own? And we do know that during the pandemic, there were many families that experienced financial setbacks, either because of job loss in certain industries or because perhaps the parents needed to stay home and stop working and take care of the kids. So what are some resources that educators might be able to refer children to if, they don't have eye care available to them or the parents can't afford it?
One thing that I would say is have educators reach out to your local optometrist. There's programs that all optometrists have access to. I mean, on behalf of ESLOR, we have our charitable arm is called the ESLOR Vision Foundation. Any doctor with an NPI number, which if you're a doctor, you have an NPI number, can sign up and get lenses and frames at no charge for children in need. Sometimes just the awareness is a little bit challenging, knowing that exists out there, but there's great programs through our charitable arm, the ESLOR Vision Foundation, that can provide lenses and frames to children that are in need. And many times the optometrist that takes part in that program will donate the eye exam as well. There's many programs out there. I'm sure my colleagues can also talk about some others as well.
Yeah, Dr. Parker, I agree. We at Cooper Vision, we have a program called Adopt a Patient, which helps get contact lenses and eye exams to children in need. And so I think the best connection is with the local optometrists who are most familiar with the programs that are available within the community.
I'll add, at Johnson & Johnson Vision, we work closely with the Lions Club, and we're starting a program called Sight for Kids in the U.S., starting a pilot in South Florida. And one of the things that parents don't realize is that comprehensive eye exams are often covered by their major medical insurance. So sometimes they think they have to have specialized vision insurance, where in reality, even if they have Medicaid, for example, there's some vision coverage under these programs as well. But as the other doctors have mentioned, I would just reach out or just do a quick Google search in their area, because there are a lot of programs available.
Okay. So here's a question. We have a couple questions about rural areas. I'm wondering, about services available in rural areas, maybe where it's harder to get, I guess, to the nearest in-person screening. Are there online resources at all for screening for children?
There really is not going to be a great online resource for vision screening. You're going to be looking at working distances. You need to see a child in person to really give the best visual assessment. You can always reach out to, in your states, there always is a state optometric association that you can find, and they can find resources for you through the AOA and your state local affiliates. They're able to help connect you with people who are going to be close to you and are able to provide services. Unfortunately, an online screening is just not, it's really not a replacement, even to an in-person screening. It's going to be inferior. And there's no sense in wasting time doing that when you could potentially just see someone locally.
Okay. Here's a question that also echoes a question that we had submitted prior to the webinar, and that is what educators can do when there's pushback, either from administrators, like this is a question from a school nurse who says, administrators are not backing her up when she insists on an eye exam for an autistic child. We also had a question submitted in advance by someone saying, what if you're an educator and you see a problem with the child's vision, but the parents don't agree with you or don't follow through? What, if anything, is there anything that educators can do in that situation where, maybe the parents are not in line with the need for an eye exam?
That's a hard question. Because obviously if a caregiver doesn't see a need, it's hard to bring that horse to drink water, right? Like what I can tell you locally, what we've done is we've actually reached out to our local schools, at least in my town. We have a small town that I go to that my practice is in, and we have proactively spoken with the principals and the school administration saying, hey, if you ever have a child that has a need, we're here for you and that we will help, whether it's at no cost or, if we can find resources for them. So on an individual level, I can tell you that that's one of the ways that we can try and get around that. In education, I think providing education to these educators, right, and teachers and reading specialists and things, I think if they can come handed with additional information that they can pass to a parent as opposed to just telling them, that can be helpful. But that's a tough one.
I also think it's really important for the educator to try to figure out the why behind the pushback. And asking the question, maybe the parent had a bad experience at an eye doctor 10 years ago. Maybe it's a financial interest that they don't want to bring up. And we've already talked about some, very low cost ways to still get a great comprehensive eye exam. So as the educator, maybe trying to figure out the why behind that. As far as educating administration, I know administrators are really busy, a lot going on. I think sometimes, once again, reaching out in your local community, your optometrist in the local community can be a rock star for you. Just setting up some information so administrators can hear from the expert the link between learning and vision. Every administrator wants their students to do better. They're graded on the scores, the test scores and things like that. So being able to make that tie-in between better vision could mean better learning, better outcomes for their students. I don't think that there's many administrators that wouldn't be open to hearing that message.
And I think that's a great opportunity for, reaching out to those local providers, because utilizing optometrists who are in clinic to be maybe an outside consultant or maybe as part of a team, like a task force, if you can incorporate an eye care professional and kind of reinforce the need for vision assessments to help, support their students in school, I think that's a great way to try and help, again, bring those resources and education to the administration.
Okay, so I'm going to ask a final question. This is a very basic question from one of our educator audience members. And she's wondering, when should we have an ophthalmologist versus an optometrist check our eyes?
Who wants to take this one?
I like all of our faces at the same time did the exact same thing. Who's feeling the most politically correct today?
So,
well, we are all optometrists on the call.
Right. Yes, I realize that.
And so, what I would say is that as doctors of optometry, we are uniquely qualified to be the primary eye care providers for the entire family, from young children, as Dr. McCleary has said, through the Infant C program, all the way to the time that the arms aren't long enough and we need multifocal lenses. The benefits of seeing an optometrist include not only a great comprehensive exam to evaluate vision, but also how the entire visual system works together, and either treat those conditions or refer. Historically, ophthalmology specializes in eye surgery. And so where there is a surgical consult required, we would certainly make that referral and ensure that that child is taken care of. But within the scope of practice of optometry, not only includes the diagnosis, but the treatment, including pharmaceutical agents, eye drops, oral medications, and all sorts of therapies that we can assist and treat conditions for your children. And we would certainly make the appropriate referral. So I would recommend that everyone start with a comprehensive eye exam with their local optometrist. And if there's something more that's needed, you will certainly get a referral.
And I can second that, because this is something I deal with on a regular basis, where, like she said, as optometrists, we look at the eyes as a complex binocular visual system. It is not just a singular organ that we're trying to correct vision on. We want to look at the whole system, whole body. And I have great relationships with local ophthalmologists, and we co-manage patients together. We are a team, and that's where optometry is really, like I mentioned earlier at the beginning of our talk, we are the gatekeepers, and we're really the conduit between all the specialty care. If there's ever a situation where it's something that's not able to be managed appropriately by an optometrist, we are definitely going to get you to the right person, whether that's a surgical consultation. And really, that's really mainly it is surgical for the most part, at least for most children, pediatric sorts of conditions. And we who do see children are going to be well connected with those ophthalmology programs, so we can get them going to the right provider if it is needed. But there's instances where, sometimes it may look like there's a problem when there really isn't. Like, for example, there's a child who may look like they have an eye turn, but really it's just an anatomical variation of an eyelid. And I'm able to, discern that and educate a parent. And there's absolutely no reason that child needs to go get a surgical consultation. So I think, like Dr. Andrews and what Dr. Parker's thinking is that we're definitely the primary person who's going to get you going to the right spot. And if there's something we can't do for that child, we will get them where they need to go.
It's also, just to add to that, we've had questions earlier about access, both geographic access and access of other types. Optometry is in all communities across the U.S. at various price points and very accessible price points for those of your parents and families who are looking for those kinds of options. And as Dr. Lee has already mentioned, there is coverage under insurance programs, both healthcare programs and vision care plans that optometrists participate in as well. So it just makes it a really great place to get your primary eye care.
And I would add too, just because so many of these children who are in lower economic, socioeconomic populations, where Medicaid is a very big insurance coverage entity, a lot of times those are really covered by the majority of the optometrists in the local area. Not all ophthalmologists take that. We're very fortunate in Connecticut that we have a really great Medicaid program for children. It's a mandated vision service for all of my kids. They're all covered in Connecticut, which is really great. Not all state Medicaids are like that, but the majority of providers are going to be optometrists, and we've got the numbers as opposed to ophthalmology, unfortunately. So, yeah, good access. Oh, did Holly freeze?
Okay, great. Let's see. Let me know. Can you hear me now?
Yeah.
Yes.
Oh, yes. Okay. All right. So, sorry about that computer glitch. So clearly there is a lot of interest in this topic, but unfortunately we've now reached the end of our webinar. So I wanted to go ahead and thank our sponsor, the American Optometric Association, and also our guest speakers, Michelle Andrews, Erin McCleary, Carissa Lee, and Ryan Parker. Before we go, I want to remind everybody that an on-demand archive of today's presentation will be available in the next 24 hours through edweek.org, and both the archive and also resources will be available, will be accessible, again, through edweek.org. I hope that everybody has a wonderful afternoon, and we really hope that we will see you again at a future EdWeek webinar.
Thank you so much.
Thanks, everyone.
Thank you.
Bye-bye.